All right, guys, I'm going to be talking this week about bracing our core. I'm seeing a lot of people talking to me about lower back injuries, and when I assess them, finding out that it's not necessarily an injury to the back. However, there might be some pain or impingement there and a flare-up. The main cause of it is lack of bracing and understanding how to stack the body and orient it so that we don't have an injury. And what I mean by that is typically that pelvic tilt where we're kind of flared out the back and we have this rounding right here. And because I'm not oriented in my hip, my spine has this kind of, you can see it as I stand here. So my hips are tilted down, okay? My butt's a little higher, and then I have this little crimp right here in my back. Now, if I go to press overhead, and I'm now under load and I'm not stacked properly, that's gonna put a pinch point right here on that hip, okay? And nerves can get pinched. The body can also, especially under heavy load, can sense that there's a crimp in the hose. So we think of the hose as our spine that goes all the way up to our neck. There's a crimp there. The messages aren't being sent, so something's happening and the body can seize up because it's trying to protect the spine from overloading and being snapped, basically. So if I'm here, right, and I'm in an overhead press, that's gonna press right here. If I have a back squat and I go to squat down, you can see it's going to flare out here, and I'm going to have that more of a crimp. So I'm putting load in the system. Most of the time, doing it unloaded, not really going to be an issue. Repetitive, let's just say 100 reps of an air squat, will flare it up, right? We can get hurt there, or if I'm hinging forward into like a lighter deadlift or anything like that, we'll flare it up. But a few reps, I can get by with it. I can get down and grab my dog food or my laundry basket, and it's not necessarily going to hurt me right then and there, but sometimes we have heard of people going, I just bent down, grabbed my laundry basket and stood up, and then I had a flare up, or that sciatic nerve pain started flaring up through the low back. So it's really important that you take what I'm about to teach you, incorporate it into your lifts and your daily routine, okay? So bracing is important. I want you to also think about a soda can. If I have a soda can, and we go to press down on it, if there's no deviations in that can, it's a perfectly, like, right off the factory line and it's good, you press down on that can, the pressure in the system does not compress the soda can. It doesn't bend, doesn't break, right? You're pressing down on it, nothing. So you can put lots of load on that before it's gonna crumple and burst, okay? Now, if you take a soda can and you put a crimp in the side of that, let's just say a dent or whatever, and you go to press it with the same amount of load, that can is going to rupture and break a lot easier, okay? So that's kind of the same here. Think of the abdominal cavity. It's creating that pressure that I'm going to teach you here in a second. And then if you put load on it, I can support that load. As soon as I cause that crimp, putting the load on it is gonna cause problems in the system. So we're gonna teach you how to brace. So one of the things that I tell people is this: we can suck it down. If we just squeeze our butt and we squeeze our legs, you can see by putting my hands here that I can kind of straighten up the system. That's one way. Now, teaching you how to do it properly is best if we're on the floor, and we have to learn how to breathe. So we're going to be just laying flat like this, and if you lay here, you'll notice a lot of us, I have this gap in my low back. I can fit my hand here, and that's caused by that pelvic tilt. We don't want that. So we want to learn to press into the ground, and everything's completely flat. Now I have no gap here, can't fit my hand back there, and that would be properly in alignment. So if I'm going to take load, we need to start from our breathing cavity, learning how to brace there and breathe through it, and then we're going to go from toes up. So we're going to think about putting our hands on our belly. Nice inhale, breathing and filling that belly up with air, and then letting it go. And then we're going to take a nice big deep breath, fill that belly. Exhale, and then when we do, we're going to squeeze it down nice and tight. Now I'm fully braced in my core, but I'm still breathing. I can still talk. I'm still taking inhales, but I'm nice and tight and firm here, and there's still no gap in that low back. Now that I have that, we're going to think about feet together, flexing our toes and our quads, so everything's nice and tight here. I'm flat here, and now I'm ready to take any load, whether that's overhead, right? I didn't come off the ground by pressing here. That would be a test. If I came off the ground here and created that, I let go of that core instability, so we're pressing in. And another way we can do it is by lifting the leg, right? And you video yourself. If I can lift without coming off the ground, usually what you'll see is a break here, and then we'll lift, okay? So it'll be very quick. You'll see it break, and then we lift. So we want to try to pin that into the ground, squeeze, and you know as I lift, maybe a little bit slower, but I'm able to keep that full brace. Now I can do that standing. If I'm here, take those deep breaths, fill that belly with air, exhale. Now I'm going to squeeze down and keep this nice and tight. Now I'm still talking to you, I'm still breathing, I'm able to take inhales and exhales, but this is still tight. Now if I'm ready to take load, let's just say back squat, deadlift, whatever, I'm going to think about my feet first, put them outside my hip, and squeeze them into the ground, and I'm going to squeeze my legs. So those are fully tight, turned on, my butt's turned on, my abs are turned on because I'm squeezing down on it. Now I'm ready to take that load. I can unload that bar, take those steps back again, and I can go into that full depth squat, and I'm keeping everything nice and tight and squeezing the whole time. Same with a deadlift. And step up to my bar, screw my feet in the ground nice and tight, take my inhale, exhale, bear down. Now I can squat down and go to that bar, and if you can see, as I go down, here's a broken system. If I'm tilted out the back, I'm going to take that load. It might look okay, but I have a little bit of a crimp here. But if I squeeze properly, orient myself, and come down, my back is a lot flatter, and I'm able to take that, and I can avoid injury. So that's on bracing. You guys can use this on any of your lifts, picking up the laundry, picking up the dog food, picking up the cat litter, anything you're doing, when you're picking something up, take that extra second to learn this technique, and I can promise you, you won't have as many injuries, and you'll probably avoid slip disc, low back injuries in the gym, okay? So it's very important that you get this down. If you guys have any questions, remember to send me a message, like my videos, subscribe to our channel, and send me messages if you guys have any questions. See you guys next week.